Well, in health news, being a woman really is a fabulous thing, but it doesn't come without some unfortunate medical issues for some. And that's especially true for pelvic pain. It leads to so much discomfort and even embarrassing things like bladder leakage or urgency sometimes. So is there some relief out there? Let's continue this discussion with nationally recognized menopause specialist, Dr. Diana Bither. Good morning. Thanks for being here.
Of course.
Right? I mean, being a woman is pretty awesome.
Pretty awesome. I wouldn't want to not be a woman.
Right, but we get the brunt of it when it comes to certain things. So explain the signs and symptoms of what women are noticing when the pelvic pain or the pelvic floor is kind of acting up.
Yeah, we've learned so much about how the pelvic muscles really interact, and pelvic pain that happens when our muscles are too tight can manifest as almost hip pain, back pain, but those muscles in our pelvis can squeeze the bladder, squeeze the rectum, and cause embarrassing, uncomfortable issues with the bladder and the rectum.
And right on the screen right now, you have some signs and symptoms of things that people, that they'll be affected by, right? That they'll notice right away. And it affects your intimacy.
It does. So
yeah.
it, definitely. So how I want you to think about it is the bones of the pelvis are like a bowl. Mm-hmm. And the bones of the pelvis are lined by muscles that go each way, from front to back, side to side, and around each opening, the vagina, the bladder, and the rectum. Okay. And so when that happens, it can cause, let's say the muscles are too tight, it can cause squeezing. Okay. So where sex might be uncomfortable, or people might have rectal urgency or rectal leaking, or sometimes the muscles are too loose and cause leaking.
And so if women who have had children, I assume that this actually adds a whole other level of complication, right, sometimes?
It does. So when women have had children vaginally, it can cause stretching of the muscles, but also damage to the tissues that support the muscles. And so if the muscles and the tissues get weak enough, then again, women can have bladder leaking when they sneeze or cough, or even rectal leaking. Mm-hmm.
Is there a certain age, is this a menopause, a midlife thing?
It's not necessarily a midlife menopause thing, but it gets much worse in menopause when the estrogen's low.
Okay. Well, let's go ahead and talk about one of your patients, Louise, we'll call her.
Not her real name.
Not her real name. What was she experiencing?
Well, she came in because of pelvic pain, and her sister had endometriosis, so she was worried that she had that. But it didn't make sense that it was endometriosis. And thankfully, because I've learned so much about pelvic floor from our pelvic floor physical therapist, Jen leads our team at Spectrum Health and is amazing, I knew to look beyond. And so again, her pain didn't correspond with her periods. Okay. It happened more when she would exercise, and she exercised a lot. So she would run long distances, she loved to do spin class, and so her pelvic pain was worse after exercise.
All right, so you obviously were able to provide her with some kind of help because you want her to be comfortable and do these things. You tell us to be active, right?
Exactly. I want her to be active. I don't want her to have a barrier. And so first of all, of course, we ruled out bad stuff. So we did a pelvic ultrasound, which was negative. Okay. Her symptoms didn't go along with endometriosis, so I wasn't concerned she needed a surgery to make sure that wasn't the case. And on physical exam, her parts, her uterus, her ovaries felt normal. Her rectal exam was negative. And so, but her muscles were real tender, and I could tell she had spasm. And so I was able to diagnose her with what we call high tone pelvic floor dysfunction. This meaning people have spasm or Charlie horse of the muscles in the pelvis. And I was able to, number one, recommend a lot more stretching. You know, she was running a lot and she wasn't taking the time to stretch. So number one, stretching. But the one thing that really made her call and come in is that when she was running, she actually had leaking of stool or BM in her running shorts. And she was like, I'm 44 years old, what's going on? So I was able to send her to Jen at our pelvic floor. She's a pelvic floor physical therapist who specializes in the pelvic floor, and was able to, using relaxation techniques, using stretching, and all the magic that they do, we were able to treat her, and she no longer had those issues.
And in extreme cases, though, what might have to be done? Is there anything?
Well, it's not a surgery thing so much. It's much more of like a physical therapy thing. So in terms of if someone has hip pain or leg pain, it's strengthening, stretching, and sometimes even things like dry needling or acupuncture. So it's all things that relate to those soft tissues, and how can we get them to be stronger and support better, but at the same time to relax when they need to relax. So it's getting all that to be functional. So we think about all those muscles in our legs, our hips, our knees, our shoulders, but we don't think about that in our pelvic floor.
Right. And a lot of things that you're doing, the exercises you were describing, that's really a midsection intense workout that she's doing, you know, spinning, running. That affects your midsection.
It really does,
So,
especially if you don't stretch, because hips start to come in
Yeah.
instead of stay out. And again, if a woman isn't keeping her core strong enough, then it throws everything off. So we've got to keep our core strong, our back strong and relaxed if we're going to pursue those activities.
Wonderful. All right, thanks so much. Some great information. And to set up an appointment with the Midlife Menopause and Sexual Health team at Spectrum Health, call 616-267-8520. Their offices are located on the west side of Grand Rapids at 3800 Lake Michigan Drive, Northwest Suite A, and on the east side of Grand Rapids at the Integrated Care Campus on the East Beltline.